Let's start with Urolift, or what is called prostatic urethral lift. This procedure allows for compression and pinning back of the excess prostate tissue with Urolift implants or clips. The procedure can be done in the office setting or the operating room, depending on both the surgeon and patient preference. The number of implants required depends on the length of the prostate and the size of the prostate. Most men do not require a Foley catheter after the procedure and need very little medicine for discomfort. It usually takes about 2 weeks for the swelling from the procedure to go down and men to notice an improvement in their urinary symptoms. The goal is to discontinue medications after this procedure. So there are a few limitations or drawbacks with Urolift. One is as the prostate volume increases, and we measure this by either ultrasound or MRI, we need it to be under 80 cc's or 80 grams. While some surgeons will also implant an anatomy called median lobe anatomy, I believe this procedure is less effective and in this setting usually will recommend an alternative procedure. So what are the odds you will need some other procedure if you get a Urolift? A recent real-world study suggests that the surgical retreatment rate, meaning you need another procedure, is about 6% per year. So if you extrapolate that to 5 years, that means there's about a 30% chance you would need another procedure. So my overall message for Urolift would be that it makes a lot of folks better if properly chosen. The recovery is usually very smooth. The downside is that the durability of the procedure does create a chance that down the road you may need something else done. Let's move on to Rezum. Rezum is water vapor steam therapy. What does this mean? The procedure is generally done in the office. To keep you comfortable, we often administer nitrous in addition to the local anesthesia provided. A scope is placed into the prostate and steam or hot water is injected into the excess prostate tissue which is blocking the channel. This causes necrosis or cell death of this excess tissue and allows for the development of a wider channel for better urinary flow. This procedure generally does require a Foley catheter for a few days after the procedure. Burning with urination is very common immediately and in the 2 weeks following the procedure. Because it takes some time for all the excess tissue to go away, it may be a month before you would notice improvement in your urinary symptoms. The procedure rarely causes problems with ejaculation, about 5% of the time. The surgical retreatment rate for Rezum isn't entirely clear, but it's probably somewhere around 3 to 4% per year, depending on the size of the prostate. So compare these procedures to more invasive procedures, such as a TURP or transurethral resection, which have about a 5% retreatment rate at 5 to 7 years. So both of these are good options for the right patient willing to accept the trade-offs. Here we have two less invasive office-based procedures which are less likely to affect sexual function, but do have a higher rate of retreatment and a somewhat less dramatic improvement in symptoms. It is important to keep in mind, though, if you do need surgical retreatment with another procedure, you haven't burned any bridges, and all the other treatment options are still available for you later down the road.